Hey, I'm Josh Linscott. I am one of the genitourinary oncology fellows at Moffitt. Excited to be here at ASCO 2024, where we're presenting our research on urinary tumor DNA in non-muscle invasive bladder cancer. You know, I think most people in the field are really well aware of how rapidly cell-free DNA, things like ctDNA, are changing cancer care. And so what we're looking at is for patients with bladder cancer, how urinary tumor DNA can do that. As a tumor sort of sheds, dies, necrosis, apoptosis, it's going to release cell-free DNA contents into urine. And we're showing that we can really measure the genomic alterations that happen there. Things like single nucleotide variations, copy number alterations, to inform us about what that tumor originally started with. What we did here is we took patients who have a non-muscle invasive bladder tumor. They have surgery which shows they have high-grade disease. They are going to have a repeat resection as standard of care. And what we thought with this setup is it really allows us to test the urine sample that is in between and see if we can detect residual disease with our assay. So we take that first tumor, we do whole genome sequencing, whole exome sequencing, and pick patient-specific mutations that will then allow us to have a really high detection level. What we found here is that the urine reflects what the patient's original tumor has. There's good concordance between the mutations in the tissue and the urine. And when you measure things like the tumor fraction, which is how much we detect these mutations, or copy number burden alterations, which are large chromosome changes, we find that actually both of these things are pretty good at detecting whether these patients have minimal residual disease. You have the tumor fraction detects with an AUC of 0.81. Copy number burden score is actually relatively similar. Because these are different things, you can have a high copy number burden score without these point-specific mutations. A combination does really well. We found that tumor fraction itself is really specific. If that's positive, patients are highly likely to have disease. If it's not, we then check the copy number burden score. And when the two are combined, we really find that overall there's a 90% accuracy to detect minimal residual disease. So in this space, we're hopeful that we can use urine to detect disease, maybe find patients who can go straight on to intravesical therapy, which they're likely to need, or definitively say, hey, you need another surgery to get rid of the tumor.